So Dr. we'll see the next question.
My name is Roshni. I'm doing BSc Visual Media in Amrita School of Arts and Science. I wanted to know how is the management of nasal polyps?
Nasal polyps അല്ലേ നമ്മൾ സാധാരണ പേഷ്യൻസ് പറയുന്നത് മൂക്കിലെ ദശ വളർച്ച. പക്ഷേ ദശ എന്ന് പറയുന്ന ഒരു ജനറൽ ടേമാണ്. അതിൽ പോളിപ്പ് ഉണ്ടാവാം, മറ്റു പല അസുഖങ്ങളുണ്ടാവാം. അപ്പോൾ സാധാരണ പോളിപ്സ് എന്ന് പറയുന്നത് പോളിപ്സിൻ്റെ മെയിൻ there are two reasons for a polyp. One is infection and second is allergy, or a combination of both, allergy as well as infection. So most commonly being allergy. So patients who are allergic, they are more prone to get nasal polyps. These are pale structures that fills the nose, and the main symptom of a polyposis is that the patient will not be able to appreciate smell. Along with the routine symptoms of sinusitis, when the patient feels that he is not able to appreciate smell, you should always think about polyposis, and it can be easily confirmed by a diagnostic nasal endoscopy. And coming to the treatment, there are two treatments. In the initial phases, when you can diagnose a very early polyps, in the very early stages, medicines in the form of intranasal corticosteroid sprays, that we call INCS. Steroid nasal sprays are the mainstay in the treatment of in the early polyposis, and also in the case of later on also. And the most important advantage of intranasal sprays are that two reasons. One, the dose is very minimal. It is only 1/1000 of the dose that we of a tablet. Okay. So a tablet എടുക്കുകയാണെങ്കിൽ അതിൻ്റെ 1/1000 ഡോസ് മാത്രമേ ഉള്ളൂ. Second is that target tissue is delivery of the drugs. ഫസ്റ്റ് നമ്മൾ ആവശ്യമുള്ള സ്ഥലത്ത് മാത്രം ഈ മരുന്ന് എത്തിച്ചേരുക, നമുക്ക് ടാർഗറ്റ് ആയിട്ടുള്ള ടിഷ്യൂസിൽ മാത്രം ഈ മരുന്ന് എത്തിച്ചേരുക. അതുകൊണ്ട് there is no systemic absorption and there are no side effects.
This is something like inhalers, right?
It is very much like inhalers. The only difference is that the particle size is 5 microns, so it will never cross the nasal barrier. It will not cross the nose. So the action is limited to the nose. It gives very sustained effect and it can be used regularly, unlike the nasal decongestant drops that are being advertised regularly in the TV. So intranasal corticosteroids can be used as sprays for a very prolonged period. I myself have been using it for past 10 years. So it is very safe and can be used for a very long time. So in later stages, when the polyp becomes too big to be managed with medicines or nasal sprays, the patient would require to undergo a surgery. Again, the name of the surgery is functional endoscopic sinus surgery. And with the help of the endoscope, we visualize the sinuses and get to the root of the polyps, that is at the point of origin of these polyps. And with the help of specialized instruments, we'll be able to clear all the disease, polyps, everything through from within the sinuses, and we can enter all the sinuses. All the sinuses can be cleared in one single sitting. And the most important thing is that as the main cause is allergy, there is always a chance of recurrence. So in such patients, when the cause of polyposis is allergy, we put them on post-operative nasal sprays. So it will help to prevent recurrence to tune of about 80%. The patient has to be on regular follow-up, and the patient has to use the nasal sprays regularly.
So we'll see the next question, doctor.
Hi, my name is Amrit. I study visual media at Amrita School of Arts and Sciences. I'd like to know what are the instruments used in the endoscopic surgery.
Okay, so regarding instruments, there are a set of basic instruments and instruments used for advanced surgery. The basic instruments are an endoscope. It is a tube-like structure which has a facet for the attachment to the camera, and this endoscope comes in various sizes for the adult size as well as pediatric size, and it comes in various angles like 0 degree, 30 degree, 45 degree, 70 degree, 90 degree. By 0 degree, what we mean is that when you introduce the endoscope, you see whatever is there just in front of the endoscope. At 45 degree, we mean it helps us to see an angle with an angle. So the structures placed at an angle of 45 degree, we will be able to see with the help of 45 degree endoscope. So various angled endoscopes and various sizes of endoscopes are available. Then you require a camera and fiber optic light source. And this will help us to visualize the structures within the nose through the monitor. So we look at the monitor and perform the surgery. So it requires a hand-eye coordination. So basically instruments are the endoscope, camera and monitor, with the help and basic instruments which help us to hold, cut and remove tissue, and a suction machine which help us to clear the operative field of blood. These are the basic instruments that are required. When coming to advanced surgical instruments, we have something called the powered instruments or the micro debrider, which helps us to do the same surgery very fast. It is a shaver system. whereas which it cuts the tissues, it sucks it out, and it helps us to maintain hemostasis, that is, it controls the bleeding. So microdefibrillator is an important addition in the list of endoscopic instruments. Then latest we have the navigation system, where it is just like the GPS that you use every day. So the navigation system helps us to know, locate our the tip of the instrument. So it helps us to make sure where we are actually working. Sometimes we might get lost. So that is importance of CT scan beforehand, because it helps us to get a proper idea of the anatomy. But sometimes if we have any confusion regarding the anatomy, so the navigation system helps us to know exactly at what point we are in. It will help us to be doubly sure regarding the anatomy, and it also ensures the safety of the patient.
So doctor, it was really an informative talk. Thank you so
Pleasure.
much. So that's all for today. Write your suggestion to us. Our email ID is youthdiaryrosewall@gmail.com. See you.